1. Dark, velvety skin spots, Acanthosis nigricans. These spots usually appear on the neck, armpits, or groin, and can also be found on the elbows, knees, and knuckles. They may itch, smell bad, or feel velvety to the touch. 2. Yellow, reddish, or brown waxy patches around the eyes, xanthelasma. These patches are made up of cholesterol deposits and are generally painless. They can be a sign of high cholesterol or triglycerides, both risk factors for developing diabetes. 3. Hard, thickened skin on the fingers, hands, or toes, digital sclerosis. This skin sign is caused by high blood sugar levels and can make it difficult to move your fingers or toes. The skin may also appear shiny and waxy. 4. Red, itchy, or blistered skin around the feet, diabetic blisters. These blisters can be a sign of nerve damage or poor circulation caused by diabetes. They usually appear on the toes, feet, or legs and can be painful. 5. Shiny skin on the hands and fingers, limited joint mobility. This skin sign is caused by elevated levels of certain proteins in the skin and can make it difficult to bend your fingers or grasp objects. 6. Small red, itchy bumps on the skin, diabetic dermopathy. These bumps usually appear on the pimples and are caused by changes in small blood vessels. They are generally painless and do not require treatment. 7. Very dry, itchy skin, pruritus. This skin sign is caused by high blood sugar levels and can affect any part of the body. It can be treated with moisturizing creams and antihistamines. 8. Open sores or wounds that heal slowly, diabetic ulcers. These sores can be a sign of nerve damage or poor circulation caused by diabetes. They usually appear on the feet and can cause serious infections if left untreated. 9. Thick, yellow toenails, onychomycosis. This skin sign is caused by a fungal infection and may be a sign of poor circulation caused by diabetes. Nails can also be brittle and brittle. 10. Hair loss on the legs, feet, and toes, diabetic hair loss. This skin sign is caused by nerve damage and can lead to hair loss on the lower legs, feet, and toes. Note: these skin signs can also be caused by other conditions and do not necessarily indicate diabetes on their own. Therefore, if you have any questions, you should consult your doctor. Thank you very much for subscribing to our channel.